Magnesium is crucial for over 300 processes in your body, from energy production and muscle recovery to sleep quality and stress response. Yet most Americans don't get enough. In fact, in a peer-reviewed clinical trial published in the Journal of the American College of Nutrition, more than 75% of participants showed suboptimal magnesium levels before the study even began. Those who took Jigsaw Mag SRT, a time-release magnesium malate tablet, saw magnesium rise 30% over 90 days, and deficiency symptoms dropped by 63%. Remarkable results backed by real science. And for sleep and recovery, Jigsaw Mag Soothes delivers. In a 4-week clinical trial tracked with Oura Ring data, participants saw a 17% improvement in sleep quality, felt 34% less stressed, and rated their satisfaction 85 out of 100. 82% said they'd buy it again. 2 supplements, 2 clinical trials, 1 company that does the research. Jigsaw Health. Mag SRT for daily magnesium replenishment. Mag Soothe for calm, restorative sleep. To order, go to jigsawhealth.com. That's jigsawhealth.com. Use coupon code Hoffman15 for 15% off your order. That's jigsawhealth.com, code Hoffman15. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's a fascinating subject, which is the use of VNS, vagal nerve stimulation, or vagus nerve stimulation, for the treatment of autoimmune disease. And this is not just on the drawing boards. This is actually a therapy that is now available for specifically the treatment of rheumatoid arthritis. It's been approved. They've worked out ways to get it reimbursed by insurance and Medicare. And with us today is David Chernoff, who is Chief Medical Officer of SetPoint Medical. And so we kind of laid down the groundwork for the theory of how this works and what it's like to get it. You have to get an implant. It's not such a big deal. It's pretty painless. You need to do it for just a minute a day. And so the question is, for patients with rheumatoid arthritis, is this an either or treatment, or can this be an add-on to their current medication? Do they have to go off their medication?
Yeah, I mean, for the clinical trial, we wash people off their medication.
For sure, right? Yeah.
But in reality, there are a lot of patients who are doing better than they were before they started, let's say, their biologic drug, but they have an incomplete response.
Mm-hmm.
They don't want to stop the drug because they feel better. It's perfectly acceptable and allowable to add this implant. There's no overlapping toxicity. In other words, you would never give an RA patient at the same time a Janus kinase inhibitor and a monoclonal against TNF, because the overlapping toxicity might cause really bad infections.
Sure.
We're not immunosuppressing. In fact, what we call it neuroimmune modulation.
Mm-hmm.
We're using the vagus in the nervous system to modify the immune response to make it appropriate for whatever the perturbation is. But we don't, you don't have to get a TB test before you get this. So it's not immunosuppressive. So it can be used, and we have a lot of patients who have used it in combination. So you don't necessarily have to get rid of all your regular medicines.
Do you have any experience with patients who are on conventional medicine? They then concurrently take the SetPoint treatment, and then they're able to wean off their medication, and they're doing okay.
Yeah, that's a really important subject, because just stopping biologic drugs acutely, there's a 50% relapse in 6 to 12 months. So
but you could also get a rebound potentially,
You get a rebound, and you may not be able to control it with the drugs that you used before. People are tapering drugs, like extending the interval. Why? Because patients, after being on Humira for 20 years, like to get off it.
Mm-hmm.
And it's really hard to determine who's going to do well with tapering or not. We have seen patients who've been on whatever their conventional meds, add the device, and then we're able to taper their steroids off. Again, this is not a controlled study to study that.
Right. It's more anecdotal, right? Yeah.
It's anecdotal. And one of the things that's been suggested that we might want to do a trial, another RA trial, where the specific aim is to see whether or not you could taper people off, because that also would be a major advance.
right under high supervised and
Right,
under you know research conditions.
right.
Yeah, that would be great. Yeah, because I mean I think a big theme in medicine these days is deprescribing.
Yeah,
And, sometimes people are on superfluous medications, sometimes people are on harsh medications, and it's hard to know because, if it ain't broke, don't fix it. You keep going back to the doctor, perpetuates your use ad infinitum,
yes,
and you may not ultimately require the burden of certain
exactly.
medications. They talk about that for antidepressants, they talk about that for, certain other medications. All right. So, uh, what's exciting about this is this kind of proof of principle that you can address a major inflammatory disorder. And so obviously your company is looking at potential other applications, kind of widening the lens to look at other inflammatory disorders. So where's the potential for that? Are we talking
Yeah,
ulcerative colitis, Crohn's disease? Are we talking MS? Are we talking even psoriasis, an
right.
inflammatory disorder?
Yeah, and I think we take the position of where is the unmet medical need? If it's a well-treated disease. So, for example, you mentioned psoriasis. Some of the new drugs that have just come out are remarkable in that they completely clear the lesions. That's called a PASI score,
Hmm.
and patients get 100% clearance of the lesions, and that is just unbelievable. And if your drug doesn't have a score like that, it's not going to be commercially viable.
Yeah,
However, the joint disease, when people have psoriatic arthritis, doesn't
yeah.
respond that way. A very small percentage of people get that kind of improvement. So that's one potential. We've been discussing with experts around the country potentially doing this in psoriatic arthritis. We have done a Crohn's trial in Europe, which was published, and we were discussing whether or not to do IBD, Crohn's, and ulcerative colitis in the US with experts. And one of the most exciting new programs is we've initiated studies in humans with relapsing MS for the purpose of trying to improve their vision, because MS is a demyelinating disease of the central nervous system, the spinal cord. One of the things that gets demyelinated is your optic tracts.
Mm.
So patients develop visual acuity disorder, and they also develop, you can measure the visual evoked potentials. It's like a nerve conduction
Is this
study in the
optic
eye.
neuritis or is this just
Yeah, I mean, optic neuritis occurs, it's
it's more
acute,
acute? Yeah. Okay.
but when you look at a lot of patients with MS and you do careful studies of their how rapidly they can transmit a visual signal. Many of them have abnormal, what's called VEPs compared to you or I.
Hmm.
They'll have, healthy humans might have 100 milliseconds as a normal
Hmm.
VEP. An MS patient might have a VEP of 140 milliseconds. So a significant delay. And based on our preclinical work in rodents, we believe that the effects on the central nervous system induce remyelination. This is sort of the holy grail.
Wow.
Remyelinating, and we have a paper that's going to be published in the next couple of months showing these remarkable effects on astrocytes and microglia. They all have the acetylcholine receptor on them. So acetylcholine, however it's getting in the brain, modifies the behavior of these cells, which allows for the immune system to remyelinate. So this is being done around the country. We've already implanted a number of patients. And having worked in MS in previous life in pharma, it's just one of these diseases. There, a lot of the drugs are really good at suppressing progression, but none of them address the issue of functional disability, like walking disability or visual
Hmm.
abnormalities. They don't get better with the medicines. The medicines are very immunosuppressive, but they prevent you from getting worse. And we're trying to use it in combination to improve your vision, to improve your walking speed.
Hmm. Again,
So that's
as an adjunct to medical treatment.
adjunctive therapy. It's not
Yeah.
to
Yeah.
replace.
Not
And
standalone. Yeah.
yeah, and so when you think about different diseases, one of the scientific principles that we think about is many of these diseases, arthritis, Crohn's, etc., have common immunologic nodes. And what I mean by that is if you look at the molecular taxonomy of these diseases, What is dysregulated? Well, in a lot of these diseases, TNF is dysregulated. And lo and behold, anti-TNFs work in all these diseases, you know. But other drugs like IL-12, 17, and 23 inhibitors don't work in RA, but they work in psoriatic arthritis and ankylosing spondylitis. So when you think about these nodes and what we can measure in the lab, we can modify the behavior of all those cytokines with vagus nerve stimulation.
But
So
by what? By altering the frequency or intensity or things?
yeah, and the
You
way
sort
we
of dial in the type
you you
of
you dial in the
current.
type,
Yeah.
and one of the things that we can do is we can look at your blood over time, after, before and after stimulation, and we can determine with a certain types of tubes how much we've altered the behavior of your white blood cells.
Hmm.
So it's like a functional assay. So you take someone's blood at baseline, then you stimulate them, you take their blood 3 weeks later, and you expose those cells to a stimulus, and you see how much you've suppressed
Hmm.
the ability of them. We never completely wipe out cytokine secretion,
Right.
which, from an
Which is
evolutionary perspective,
which is
would
good.
be,
Yeah. Yeah.
and we don't seem to increase infection rates. So we've just scratched the surface
Hmm.
here.
Hmm.
And other groups, a group in Colorado and a group in Belgium, have shown that vagus nerve stimulation has similar effects in their rodent models, which means it's not just the company saying it. Other groups, and we're working with Johns Hopkins and many of the top academic centers around the country on this sort of novel remyelination study.
So it sounds like you're gaining experience. You're refining the treatment
Right.
and refining the delivery systems, and ultimately there may be a different way of treating other inflammatory disorders than the protocol you use for RA.
Yeah, and I think, going back, 25, 30 years ago, there was a lot of skepticism amongst neurologists, like why would vagus nerve
Hmm.
stimulation work? The group in Germany showed it. It was a slow introduction, but 25 years later, they're still doing it.
Yeah.
And it works. And a lot of these people cannot tolerate drugs. And we know that our therapy works in RA. You have to not, it doesn't work in everybody. So I think that the reason I was so interested in working on this, it's so different than what we conventionally work on,
Hmm.
and yet potentially so disruptive. We're not trying to put pharmaceuticals out of business. That'll never happen. But for a lot of patients, the drugs don't work, or they can't afford them, or they can't remember to take them. And this is at least a non-pharmacologic, FDA
Yeah.
approved therapy.
And ultimately, it could actually reduce healthcare costs because these
Yeah, we
medications
think,
are they're on patent, they're very expensive, they're injectables, and so on.
yeah, I think we've already published a health economics study. It's very easy. You don't have to be a health economist. The list price of many of these drugs is 90 plus $1,000. And of course, nobody pays that because they're rebates and they're
Yeah. Yeah.
PBMs and or kickbacks or whatever you want to call them. But 1 year of therapy theoretically costs almost $100,000. The implant goes in once,
Yeah.
and can be good for 10 years. So if you don't take biologic medicines for 2 or 3 years, you've already paid it back.
Indeed.
A one-time implant.
Indeed. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Please listen up. Magnesium is crucial for over 300 processes in your body, from energy production and muscle recovery to sleep quality and stress response. Yet most Americans don't get enough. In fact, in a peer-reviewed clinical trial published in the Journal of the American College of Nutrition, more than 75% of participants showed suboptimal magnesium levels before the study even began. Those who took Jigsaw Mag SRT, a time-release magnesium malate tablet, saw magnesium rise 30% over 90 days, and deficiency symptoms dropped by 63%. Remarkable results backed by real science. And for sleep and recovery, Jigsaw Mag Soothes delivers. In a 4-week clinical trial tracked with Oura Ring data, participants saw a 17% improvement in sleep quality, felt 34% less stressed, and rated their satisfaction 85 out of 100. 82% said they'd buy it again. 2 supplements, 2 clinical trials, 1 company that does the research. Jigsaw Health. Mag SRT for daily magnesium replenishment, Mag Soothe for calm, restorative sleep. To order, go to jigsawhealth.com. That's jigsawhealth.com. Use coupon code Hoffman15 for 15% off your order. That's jigsawhealth.com, code Hoffman15. You know that feeling. You're exhausted, but your brain just won't quit. You're staring at the ceiling, watching the clock, dreading the morning. Here's something that actually helps. It's called Kyolic Specialty Series Sleep Mushrooms Plus. And it's unlike anything you've tried before. This isn't some chemical sleep aid that leaves you foggy and dragging the next day. This is a clean botanical formula built around certified organic reishi mushrooms grown on real farms, not in a lab, combined with valerian root to help you fall asleep faster and stay asleep longer, L-theanine to quiet that racing mind, and Kyolic aged garlic extract, one of the most trusted wellness ingredients available for circulation and stress support. It's vegan, non-GMO, no gluten, no dairy, no artificial anything. Just 2 capsules, 2 hours before bed, and you wake up actually rested, not groggy, not out of it, just refreshed. Kyolic Sleep Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening, and thanks for supporting our sponsors. They are what make Intelligent Medicine continuing free resource with great guests like today's guest, Dr. David Chernoff. Okay, because I'm just imagineering here a little bit. There are other diseases where it is thought inflammation plays a role. And one of the most challenging diseases, because you're looking for things that are not currently easily addressed. And one inflammatory disease of the brain, in addition to MS, which affects younger individuals, we've got Alzheimer's disease. And Alzheimer's disease is, there is an inflammatory component. Is there any thought to applying this to Alzheimer's disease? Because even making small inroads against Alzheimer's would be a tremendous benefit.
Yes, and I happen to have worked in the past with Elan Pharmaceuticals and Biogen, where we focused entirely on novel approaches, small molecules, vaccines, antibodies to mobilize amyloid out of the brain. Irrespective of whether or not you believe the amyloid hypothesis or the tau hypothesis, there are fundamentally dysregulated pathways in the brain where these tangled proteins are not cleared. And one of the properties that we found when we stimulate the vagus in the rodent models of MS is we increase the ability of the phagocytic cells in the central nervous system, like microglia, to clear this molecular debris. It's called efferocytosis. They, like, instead of eating a bacteria, they're eating beta amyloid. And
so like little Pac-Man,
little Pac-Man
cleaning up the garbage. Yeah.
Right. Antibodies bind to it and take it out of the brain, and there's side effects from it. So there's a very standard set of models for Alzheimer's. The transgenic APP mouse, the tau mouse, all of these models are used. You see how the animal walks and remembers mazes. And I'm certain that if we were to do these models, we'd have a positive impact. Now, whether or not that translates to clinical efficacy is challenging. It also could work in Parkinson's disease, because in Parkinson's, you also have abnormalities in alpha-synuclein. There's a lot of inflammation in Parkinson's, and just replacing the dopamine pathways. And we know from functional neurosurgery, if you have bad Parkinson's, you do electrical stimulation of the brain with DBS. It stops the shaking completely.
Yeah.
The reason that not everybody does that is not everybody wants to have electrodes put into their brain. But in every case in Parkinson's where you look at neurostimulation compared to conventional drugs, the neurostimulation always works better.
Well, as you have background in rheumatology, and as you know, rheumatoid arthritis is part of a family of rheumatological disorders, some very serious, like Sjogren's, and it's lupus, and on it goes. Is there a potential for applying this therapy to those conditions?
Yeah, and lupus is a really challenging one. I remember starting my research career at UCSF working on lupus, and there have been some advances in antibodies over the years, but for the most part, there hasn't been the kind of explosion
Hmm.
of
There's no slam dunk
reagents.
for it. Yeah.
There's no slam dunk. The disease is very heterogeneous. People are using a lot of steroids. So there are groups like the Feinstein are looking this at lupus, Betty Diamond and others in Long Island are doing this. Sjogren's is also a disease, can be associated with RA or primary, where there aren't really good therapies for the xerostomia and so we haven't looked at all these models. But when you look at these diseases and say there's really good, like if you have psoriasis, you get on the right drug, you can be completely cleared.
Okay.
That's a home run. We're never going to get that there. But for other diseases where the responses are very, very modest, we should be doing better. And one thing that's a little startling is that, and when I present this to rheumatologists, they're kind of shocked. There hasn't been a new molecular class of an RA drug in 14 years. The
Hmm.
last drug, new molecular mechanism, was in 2012 when tofacitinib, Xeljanz, was approved for Pfizer.
Hmm.
Now, granted, baricitinib came out a few years
It's a
later, and
JK
then
inhibitor.
a JAK inhibitor,
Yeah.
yeah, a JAK 1, 2, and 3 inhibitor, and then Rinvoq or upadacitinib came out in 2019. It's a better drug,
Hmm.
but it's the
This,
same
this is a Me
class.
Too drug. Yeah. Hmm.
It's these are all, and now everything's biosimilar. So
Yeah.
my brother runs a cancer center. Every couple of months, there's a new drug for cancer.
Yeah.
And with all the pharmaceutical
Hmm.
effort, nothing in almost 15 years new,
Okay.
which is really shocking.
And again, I'm thinking out loud. Another inflammatory disorder. There's certainly an inflammatory component in asthma and in COPD.
Yeah.
Has there been thought to apply it to those pulmonary disorders?
Yeah, we know that acetylcholine, the muscarinic system is very active. People use antimuscarinic agents and inhalational agents. It is an intensely inflammatory disease. There are a lot of interesting new monoclonals against IgE
Hmm.
and against mast cells and eosinophils that are coming out. So there has been actually a lot of progress. Having been a severe asthmatic as a kid, I wish that was available because everyone was just inhaling, beta agonists. So it's theoretical, but I think those diseases, which are acute and chronic inflammatory diseases, may be accessible through this. And, there are, like in RA, about a third of the patients with RA have interstitial lung disease.
Hmm.
Can be a fibrosing lung disease like IPF. There's no real therapy for that. So it's possible that vagus nerve stimulation might work in those settings.
So practical considerations, when you're going through an airport checkpoint, is it going to set off the alarms? Do you have to tell them that you have a device implanted? Are you concerned about, maybe activating it somehow
Yeah,
if you're near an electrical field, something that inadvertently it's going to
yeah.
go off?
So the answer is it does not activate TSA scanners. The only thing that might happen is if they open your bag and they see this charger in there, this necklace with magnet, they might say, "What is that
Yeah,
for?"
yeah,
But like if you have a titanium hip, it
yeah,
obviously will
yeah.
set up the scanner. But more importantly, this device is safe to use in an MRI scanner, and the
Oh,
reason that's important
so
is
it won't like
is
suck it out,
yeah, I
Yeah,
mean, if you've ever gone, I had a MRI scan because I ruptured a disc in my back. I went to UCSF and they asked me like 20 times,
yeah,
take out all the metal in your body, your
yeah, yeah,
piercings.
yeah,
And so
yeah,
I said, okay,
yeah.
don't have it. This device, we've designed it to be MRI compatible. So a patient who's implanted, let's say they injured their neck, the
Hmm.
device is near C5. They
Hmm.
have to get an MRI scan of their neck.
Yeah.
In a regular commercial magnet, 1.5 or 3 Tesla magnet, it's completely
Okay.
safe.
Okay. That's
It's
good.
not going to pull the
Right.
thing out, heat it up.
Right.
So that's very important that the patient is not prevented from having
Right.
a scan if indicated.
So you can travel with it.
Travel with it.
You have to charge it frequently.
No, so the charger is like it's a magnetic class band. There are inductive coils inside of that. You charge that on a charger stand. When you charge it, let's say once a week, you put it on, it locks with these magnets for about 5 to 10 minutes, and it's inductively charging
Mhm.
the device without touching it, sort of like
Like
a
when you
Qi
charge,
charger.
yeah, like when you put
Like,
your iPhone
yeah,
on a
but you
table
don't have to
charger.
put it right
Yeah.
to it. So the charging of it is simple. We tell people, once a week, maybe on a weekend, you're having coffee in the morning, put the necklace on and wear it for 10 or 15 minutes.
Hmm.
The battery will last for months uncharged, but we don't want people to get very low, the
Okay.
battery get very low. And again, we know that it's good for at least 10 years. We've had one in for 10 years in a patient. And so it's the design of it was really well thought out, and we just had to test it in people, make sure it worked.
So it's unobtrusive. You can do exercise and work out
You
with
can
it.
do anything, and most of our patients are women. Unfortunately, women get autoimmune disease at least 2 or 3 times higher than men. And the way the neurosurgeons do the incision in a crease in the neck,
Hmm.
because cosmetically, most women don't want to walk
Right. A
around with a
scar. Yeah.
Frankenstein-like
Yeah.
gash in
Yeah.
their neck,
Otherwise, they have
like
to
a
wear turtleneck for the rest of their lives.
right. So you can't see it and you
Yeah.
can't feel it. You just know it's there when it goes off. The other thing we've done is we did extensive cardiac monitoring of patients with these like Zeo patches.
Right.
You wear it for 2 weeks. We did that in a previous study to make sure
Yeah, because it's
with continuous.
electricity near the heart, et cetera, et cetera. Yeah.
Yeah, and we wanted to make sure that we didn't induce bradycardia in people
Yeah.
because maybe at night they
Well, that
got
too.
bradycardic. So we did all that and we looked at HRV. We did not cause bradycardia. We did
Okay.
not cause bradyarrhythmias and we did not cause syncope. The reason is it's in the left side of the neck. It's on for only 1 minute a day. And in
Okay.
humans, the left vagus cardiac branches don't get near the sinoatrial node. They
Oh.
only innervate the AV node. So you
Oh.
can get AV slowing, but you won't get
Right.
sinus
No,
arrest. The
because if you
right
get
side.
a very strong parasympathetic impulse to the heart, it
Right.
slows the heart, and it
It'll
could
slows the
actually
heart down.
drop your blood pressure. You could feel dizzy and pass out.
Exactly.
Yeah.
Yeah,
Yeah.
that's a typical vasovagal reaction. That's
Right.
really the real outpouring of acetylcholine.
Yeah.
You can do that also by sticking your face into a bowl of ice
I,
water.
I actually did that once with, I was giving a lecture and a guy said, I have a question. And I said, well, could you hold your questions till the end? He said, no, this is urgent. He said, I think my heart rate is very rapid. And I checked his heart rate. It was like, nearly 200.
Yeah, so
And
it's a rapid
I
AFib
said,
probably.
call 911. And I took him to the bathroom, and it happened to be the middle of the winter. And I filled up the sink with, the cold water, and it was like icy cold. And I said, dunk your head in that. And he said, what? And I said, yeah, do it. And it broke it. He
Yeah.
went back into sinus rhythm,
Yeah, you can try Valsalva, but exposure causes this cardiac, dive reflex where
or
it slows
carotid
everything.
massage is thought to
Carotid
be.
massage, yeah.
Yeah.
I had an experience with electroacupuncture, which convinced me. I didn't know it at the time. I had a bad car accident with a severe left hand injury and developed complex regional pain syndrome, what we
Wow.
called RSD,
Really challenging.
hypersympathetic,
Really challenging,
debilitating. And I'm left down. And I finally couldn't take, the narcotics. So I went to an acupuncturist. And I never had experience with acupuncture, a well-known acupuncturist in the Bay Area. And I asked him, Dr. Mao, why are you sticking all these needles in my face and my ear?
Hmm.
Like, what's going on here? He said, I can't explain it to you. Then
Okay.
the next thing I know, he's attached an electrical generator to the electrodes that are in my ear.
Uh-huh.
He's doing electroacupuncture.
Yeah.
And over a period of about 4 to 6 months, my RSD completely went away with no
Wow.
drugs.
That's
And
impressive.
then many years later, when I took this job and I educated myself in this area, I went back to him and I said, now I understand what you were doing.
Yeah.
And
It's
that's a
about
disease.
it's about
Yeah.
achieving the set point. It's like a
Right. And
reset,
that's
like a reboot kind of.
Yeah, that's a hypersympathetic
Yeah.
disease where
Yeah.
you use alpha blockers. So
Yeah.
that experience and learning about it in retrospect convinced me that they're onto something and we just have to catch up.
Absolutely. Okay. So very, very exciting stuff happening at Set Point Medical. I think this is a very promising therapy for a variety of disorders, not just rheumatoid arthritis. And I wanted to educate our listeners to that potential. So you can find out more at setpointmedical.com and find out if you have rheumatoid arthritis, you want to try it, find out if you're eligible, and if this treatment might be right for you. It's fantastic. And, all the best of luck. And, perhaps we'll bring you back, when there's some new announcements or some new breakthroughs because the research is ongoing.
Right. I really appreciate the opportunity to talk about this very novel new therapy and very exciting. And we're going to keep hammering away and getting these studies done.
Well, yeah, kudos to you also, as a conventionally trained physician, rigorously trained, for stepping a little bit out of the box and having the openness to examine what seems like an exotic paradigm, but a paradigm that ultimately pays off for a lot of patients.
Yeah, and ultimately you have to kind of take risks in your career and do things that are non-conventional. If everyone thinks you're doing great stuff, you're not working on something important. So.
All right, yeah, you got to endure the slings and arrows for a while, because innovators sometimes face opposition. But
Yes.
I think with rigorous research under your belt, I think we're going to push some of these therapies through. Fantastic. Great talking to you, Dr. David Chernoff, and all the best.
Thank you very much. Appreciate it.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs: heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.